And so we start with the slide where we stopped. Did we stop with this slide? No. It's like here. Mm-hmm. Who was the last person to read? Ritik? Ritik was, right?
I have poor internet connection, so I cannot able to read last time.
I see. Okay. Mm-hmm. Let us listen to Shoaib.
Yes, ma'am. Ma'am, DOPs includes a range of procedures. For example, venipunctural Ford cannulation, the use of local anesthesia, RTL punctures in an adult, and like blood culture peripheral, which we call it peripheral, and blood culture central. Also include our nasogastric tube insertion and airway care, including simple adjunct and intubation.
Mm-hmm. Well, here we have the description of different procedures, examples, yes, of procedures. And so cannulation, this is not for, this is
including cannula.
Okay.
Insertion of cannula.
Ma'am,
the use of local anesthesia.
Cannulation, okay. And you know about these procedures more than me.
Stick method for compartment syndrome as well.
Okay, and well, let's move on and listen to who else is Unica. Let's listen to Aman now, please, part.
Yes, ma'am. Ma'am, each doctor needs to satisfy a number of criteria, some of which are given below. Apart from overall ability to perform a particular procedure, the trainee needs to demonstrate an understanding of relevant anatomy and the technique of the procedure. There needs to be a clear demonstration of appropriate preparation before the procedure takes place, as well as the knowledge of the appropriate analgesia or safe sedation and aseptic technique. Ma'am, this paragraph means that a particular doctor needs to follow a set of rules or a set of criteria, and some of them are given in this paragraph only. Apart from like the normal procedure, the participant or the person needs to have a common understanding of the proper study of or anatomy, we can say.
Okay.
And he should also know the techniques and experience for the procedure.
I see. And this is the points how the participation is evaluated, right? Mm-hmm. And so the last piece of information, let us listen to Apeksha, please. Read it.
Yes, ma'am. Apart from the technical ability, a trainee needs to seek help where appropriate and demonstrate post-procedure management as well as good communication skills, while at the same time considering the feelings of the patient.
Mm-hmm. So the focus is here on management skill and communication skill. So post-procedure management. Mm-hmm. Okay, and so I think we understand everything. And now, according to the article, which alternative italics below makes these sentences true? You see there are two options in each sentence and we should choose one of them. Well, Misha, you start with the first sentence, please.
Yes. During the year, trainees are examined by the various assessors.
So you've chosen various assessors.
Various.
Yes.
Yes.
Do you all agree with this?
Yes, ma'am.
Yes, ma'am.
Okay, great. So let's move to Nivas.
Yes, ma'am. The timing, the procedure, and the observer are chosen partly by the trainee.
So if we go back to the text of the article, I don't remember where can we find it. So, and so the trainee trainees should choose from each of the core problems. The trainee chooses the timing, procedure, and observer. So there is a sentence here. So it's not somebody chooses for him. This is
Solely.
solo,
Solely is the right answer.
solo
Yeah.
by the trainee. Okay. Well, Vandana, the next please.
Yes, ma'am. DOPs were created by the RCP, adopted by the RCP.
So you choose adopted.
Yes.
We should remember that this procedure, so let us find it in the text.
I think
This
it is created by the RCP.
Yes.
Created.
So it says that DOPS is a method that has been designed.
Designed, created.
Designed means
Created.
created by the.
Yes,
Yeah.
we should choose created. Okay, the next is Priyesh, please.
As a part of foundation program, it is that the weakness of each trainee in DOP should be. It is suggested that the weakness of each trainee in a DOPS should be improved. Suggested.
So suggested,
Expected.
or should we say that they must improve all the weaknesses?
Expected.
It is expected that the weakness should be
should.
improved. Mhm. Well, the next is for Rakhav. Rakhav? No Rakhav. Minus. So, Ujjwal?
Yes, ma'am. Preparation for a DOPS encounter on the part of the trainee needs to be, ma'am, fairly evident because he must be a trainee, so it's fairly evident.
Fairly or very?
Ma'am, it's fairly evident.
Fairly sounds just not so strong as very.
Ma'am, because he was a trainee, so that's why I was saying.
No,
He
this
was
is
not
the
a
program
specialist.
not to be to undergo training. This is not the program that teaches somebody, the doctors. This is the program that evaluates the final result, the skills, evaluates the skills. That is why we need to choose very evident, so that the doctor prepared for this program, for the meeting carefully. Okay, and the next one is for Sayonika.
During a DOPS, a trainee may seek help from anyone else
Yes.
so
this
that he
is-
can give a proper observation.
Yes, that is what we're speaking about, that in any situation, doctors may seek for help. And the next is for Rohit is absent. Ritik, please.
Yes, ma'am. The communication skills are considered during the examination. Because, ma'am, doctors have good communication skills with their patient to briefly understand their problems and explain their problems also.
Exactly,
to each
yes.
other.
So, and so there are several questions here on this slide. We should try to answer them. Shoaib, will you read the first and answer the first question?
Yes, ma'am. Ma'am, what is the purpose of DOPs? Ma'am, the main purpose of DOPs is like to train a person, which you call as trainee, ma'am, for a good medical procedures or good medical skills.
It's the purpose is just let us say provide feedback. Yes.
Yeah, ma'am. Provide feedback
on the skills, on the practical.
Yes, ma'am. All the skills.
Okay, what about the second? Let us listen to Aman. Aman.
Ma'am, how many times a year will you see? Ma'am, training should be observed very frequently For example, once in a week, maybe.
What does the article say
So
about
that could
how many times? Who remembers? Okay, let us have a look at first.
3 to 5.
2 times.
Aman, do you see?
six observed encounters means 6 times a year.
Yes, 4 to 6 times. Okay. And so then, Apeksha, please.
Yes, ma'am. What kind of specialists are the
Number three. Number three.
Yes. Oh, sorry. How long does each procedure last? I guess just right now, Aman said the answer for this.
It's 20 minutes.
Each procedure lasts for 20 minutes. That is 15 to
Okay. Assessment and then feedback. Well, and so Misha.
What kind of specialists are the assessors? Basically, assessors are the nurse and the other staffs that are present in the hospital that help us in secondary assessment.
Okay, great.
Secondary care. Yeah.
Yes. Okay. Nivas.
Yes, ma'am. What competencies are the trainees assessed in? In this, ma'am, we have to know that they have how to plan assessment to meet the requirement of their organization and the assessed person. They have to identify and collect the required evidences in a valid and authentic and sufficient manner. They have to do this.
So it means that they are assessed in practical competences, right? Practical procedures. Okay, and the next is for whom? Vandana.
Yes, ma'am. Which organization created the DOPS? Ma'am, as we saw, the College of what was that? College of Physicians. The Royal College of Physicians.
College of Physicians.
Royal College of Physicians. Yes.
Okay, yes, great. So let's move on and focus on criteria. What criteria are mentioned in the last paragraph? Criteria of evaluation. Do you remember them? So the Priyesh. Priyesh, hello. Priyesh? No, Priyesh. Ujjwal?
Yes, ma'am. Ma'am, their criteria like they have to perform a particular procedure. That how to perform their ability to perform a particular procedure, their understanding to for the relevant anatomy and their techniques to how to do the procedure. Method for the proper analgesic and safe sedation methods. Their method for demonstrate the post procedure management, I think, and their ability to increase the good communication skills so they can make easily communicate with their patients.
Great, thank you so much.
And they had to perform some abilities to make understanding between their other trainees. Like they had a responsibility to take help if they didn't care properly, so they take help from others.
So this is also part of communication skills. Okay, good. Thank you. And so here the criteria are given. Yes, here they are. Okay, so, and now we are going to move to the discussion of the way how can doctors deal with their patients and how can we give instructions to the patients. So here on this slide you can see several pictures, and we're going to listen to the extracts from the conversations between doctors and patients, and our task is to listen and to match each instruction with the pictures. So there are no numbers here, unfortunately, but anyway, we can see the first row, the second row, we can say the first picture, the second. So in the first picture, the last picture, and so on.
On total 7 pictures, we can evaluate by numbering.
Yes, exactly. Okay. Now let us just, I'll switch on the recording and you'll tell me if you hear or not.
Listening to 1. Can you just bin?
Do you listen? Do you hear?
Yes, ma'am.
Yes, ma'am.
Yes.
Now
Yes, ma'am.
I'm
Yes,
going, I'll switch on the recording one more time and now we should match.
Listening to 1. Can you just bend your head slightly to the left? Okay.
Which picture is it?
And third picture.
Ma'am, last one.
Ma'am,
The
it's
last
last
one.
picture,
Last.
slightly,
Last one, ma'am.
Seven.
Last
Last
one.
picture.
Yes, last one.
Seventh number.
slightly to the tilt to the head to the left.
Yeah.
Yes, bend in the head.
Bending that
2.
last picture.
I'd like you to raise your arm above your head for me.
The fourth picture.
Fourth
Fourth
one.
picture.
This is the
Fourth
Fourth
one.
picture.
And
picture.
fourth
The
picture.
first picture about raising the arm. Okay.
Now roll your sleeve above your elbow. Yes,
Fifth
that's
Ma'am.
fine.
Ma'am,
Fifth
fifth.
picture.
Fifth picture.
Ma'am,
The
fifth
fourth picture, yes,
Fifth
this
picture.
Yes,
one.
ma'am.
Yes, ma'am.
Mhm,
is
okay.
folding his elbows.
Mhm.
4. Would you just pop up on the couch for me? That's it.
Ma'am,
First
first.
one.
The
First
Third
one.
one.
The first one.
First
First.
one.
The first one, ma'am.
First one.
First
First
one.
one.
First
Pop
one.
up on a couch. Mhm.
Yes.
5.
Could you lean forward a little bit for me? Good, that's it.
Third
Third
one.
one.
Third
third.
one.
Third one. Third
Yes,
one.
this one.
Third one.
About
Yes.
leaning forward. Mhm.
Forward.
6.
If you could just move towards the edge of the couch. Yes, that's it.
The sixth
The
one.
second one.
Second.
Fifth one.
Sixth one.
Second.
Sixth.
Second
Sixth
one.
one.
Second
Yes,
Fifth
one.
one.
this
Fifth
this
one.
one. You're right. Yes,
Sixth
about
one.
Sixth.
moving towards the edge of the couch. Mhm.
Yes.
Then
7. Now I want you to just turn over onto your tummy.
Second one.
Second.
Ma'am, second one.
Second.
Second
Second
one.
one.
turn
Second.
over on your tummy. Yeah.
Yes.
Okay. You see that when doctors talk to their patients, they use another form of instructions. They
Yes.
want to sound more polite. That is why let us focus on what the doctors say. I want you to listen for the second time and please prepare paper and write the exact phrases which are said by the doctors in each of these situations. Just, yes, do you have paper? Are you ready?
Yes,
Yes,
ma'am.
ma'am.
Mhm. Okay, so let's listen now. Start.
Listening to 1. Can you just bend your head slightly to the left? Okay. 2.
I'd like you to raise your arm above your head for me.
3. Now roll your sleeve above your elbow. Yes, that's fine. 4. Would you just pop up on the couch for me? That's it. 5.
Could you lean forward a little bit for me? Good, that's it.
6.
If you could just move towards the edge of the couch. Yes, that's it.
7. Now I want you to just turn over onto your tummy.
Well, did you manage to write all the phrases or do we? Yes, let's listen for the second time just to be sure that we hear everything.
Listening to 1. Can you just bend your head slightly to the left? Okay. 2.
I'd like you to raise your arm above your head for me.
3. Now roll your sleeve above your elbow. Yes, that's fine.
4. Would you just pop up on the couch for me? That's it. 5.
Could you lean forward a little bit for me? Good, that's it.
6.
If you could just move towards the edge of the couch. Yes, that's it.
7.
Now, I want you to just turn over onto your tummy.
Well, and so we stopped with them. Yes. Is Priyesh here?
Yes, ma'am, there is some emergency. I'm getting calls. That's why I wasn't here. I'm here right now.
I see. Okay. So the first picture was about bending the head. What was the phrase that the doctor said this conversation?
Ma'am, actually, I didn't hear. I was on a call.
I
was
see.
getting.
Okay. Ujjwal.
Yes, ma'am. And the doctor says, will you slightly head to the left? Slightly move your head to the left.
Not. It wasn't. Will you? It was another phrase. Sayonika, did you hear the phrase?
Can you slightly tilt your head to the left?
Yes. Can you just
Bend your head slightly.
Just a bit.
Slightly to the left.
Okay.
Slightly to the left.
Just slightly to the left.
So then the next, the picture, the second picture was about, the second conversation was about raising the arm. Ritik, what was the phrase said by the doctor?
Doctor said, raise your arm above the head for me.
And the doctor tried, just was very polite. And what kind of?
Could you please?
No. What was the phrase?
That's it. Thank you.
Right.
So the phrase, there was another phrase used here.
Ma'am, I like you to raise arm.
Exactly. Yes, I'd like you to raise your arm.
Yes,
Raise your
ma'am.
arm. Raise your
I
arm.
am
Forehead.
saying that raise your arm above the hand for me.
Okay, yes.
Head for me.
So the next picture was a picture about rolling your sleeve. Try, do you remember?
Yes, ma'am. Now roll your sleeves about your elbow.
Yes, so he started with now, just and
Yes,
that's it, okay? The next picture was the picture number 4 was about popping up on the couch. Aman, what did the doctor say? Aman?
Can you please pop up on the couch?
We listened to the conversation 3 times. No, it was not can. What did he say?
Would you?
Yes.
Would you?
Would you pop
just-
up? Okay. And Peksha, the next is 5. This is about leaning forward. This picture.
Can you lean a little bit for me?
For me, yes. So good. Isha?
Ma'am, yes.
Misha is having a little bit of network issues. She'll join in 5 minutes.
Who?
Misha. Misha is
Misha,
having a
I
little bit of
see, I
network
see,
issues.
okay.
She'll be joining in 5 minutes.
I see. Nivas, please, about leaning. Or what? Yes? Nivas.
Yes, ma'am. Would you just could you lean a little bit for me?
Then there was about moving towards the edge of the couch, Vandana.
Yes, ma'am. If you could just move to the edge of the couch for me.
Exactly, exactly. And Priyesh, did you hear what was said about picture in conversation 7 about turning on?
Can you, ma'am? I didn't hear, but I can predict that the conversation that can you turn around?
Okay, that was actually, who remembers what was said by the doctor?
Ma'am, I want to turn around your tummy. I want you.
I want you to turn on around your tummy.
Exactly.
Yes.
Yes, ma'am.
Now, it's very important to understand the way
Listening to.
We should talk to our patients. And here there is information about this. I mean that how to make requests to patients polite. So when we were speaking about giving instructions to our colleagues, other doctors, nurses, we said that we should be short and precise, and we should use short sentences like steps of some to describe the steps of a procedure. But giving instructions to a patient, we should use using simple imperative structures can sound very harsh or rude if a patient is ill. The person is weak, and we should be more polite. To soften imperatives, we can add "for me, please," like in the example, "undress for me, please." Or we can use can, could to make the instructions gentler. So in this way, we change instruction into a request. Could is slightly gentler than can. Like here, the construction is, can you just plus infinitive plus please. And we also use just. And the examples here, can you just bend your head forward for me, please? Or could you just bend your head forward for me, please? So then another piece of information is about using the phrase if you can, or could you just plus infinitive plus please. Or if you can, or if you could, just goes at the end of sentences of the sentence after the infinitive. If you can just bend your head forward for me, or if you could just, and so on. And this sentence, just bend your head forward for me if you can, or if you could. Well, and one more structure which can be used in polite requests. We can also use I'd like you to do something. I'd like you to plus a verb. I'd like you to just bend your head forward for me, please. And we can also use such phrases as now. You remember that some phrases started with now. Okay, that's it, fine, just that's fine, good. Just to make the patient feel comfortable, right? And so let us have a look at sentences which are given here. And we should decide which of these instructions are inappropriate to use with the patient. Let us listen to Sayunika.
Yes, ma'am.
The first slide here. Read it, please.
Could you just lie on your left side for me?
Is this phrase appropriate or inappropriate when we talk to a patient?
No, it's appropriate.
Appropriate, of course, because it's rather polite. Could you, and just, and for me. Okay. Ritik, please.
If you could just pop up your cloth and then.
Appropriate or inappropriate?
I think it inappropriate.
Why?
Because it shows a minor suggestion or an order or a command. We can say it as if you could please just pop your clothes and then.
You just,
we can use please also.
I see, thanks, good, okay. Well, the next is for Shoaib, please.
Yes, ma'am. On your left side, please. I think this sentence is inappropriate and ma'am, incomplete also. Ma'am, we can just, ma'am, like we can request them like in the first sentence, could you just lie on your left side for me, ma'am?
Okay.
This thing. Yeah.
Okay, thank you. Good. So, Aman, please, the next phrase is for you.
Yes, ma'am. Just bring your legs up to the up to your chest. Yes, like that, and relax. Just going to. Ma'am, I want to add something. Can you just bring your legs up to your chest? Yes, like that, and relax. Yes, like that, and relax. I'm going to.
Okay.
After that, everything is
Mhm. Thank you. Anyway, just is used here. Yes, you are right about adding some more polite just formula to the first part of this, to the first sentence. And then here later, the doctor explains just to the patient what he's going to do. This is also very important to do in the conversation. Well, the next is for Apeksha, please. Line
Yes.
E.
Can you just bend your knees towards your chin and curl your neck? This is an appropriate sentence.
Appropriate. Right, okay. So the next is for Misha. Is Misha here?
Yes, ma'am. I'm here.
Please.
I would like you to stand up for me if you can. This is an inappropriate sentence, ma'am.
Inappropriate.
Yes, ma'am. It's
Why?
inappropriate. I would like to, we cannot ask a patient like that. I would like to. Can you just stand up for me if you can?
So I'd like you is also good. It's rather polite, and everything is okay with this phrase. And the last one is for Nivas.
Yes, ma'am. Take off your shirt. So this is inappropriate, I think.
How can you improve this phrase?
Put off is used. Take off.
Sorry?
Could you
Put off.
Yes, could you take off your shirt, please? Yes, like this. Or if you could just take off your shirt. Good. So, and so we understand what kind of phrases we should use in the conversation to a patient, and here are the phrases with the gaps, the sentences with the gaps, and we should complete them with the words, colored words which are given here. Make, tilt, pop, keep, stand up, cough, turn. So I think we need to focus on tilt. Tilt is like bend. And you can also see the picture that illustrates one of the sentences. What is there in the picture? This is a screen, yes, hospital screen.
Yeah.
Now let us have a look at the sentences and decide. You should choose one of the words given here, and you can also add something else to the sentences. And let's listen to Vanda.
Yes, ma'am.
The first one is for you.
Can dash the screen and undress for me, please? Can you can you turn the screen and undress for me, please?
Any other versions?
Or tilt the screen.
So pop is better to use.
Pop the screen. Yeah.
Better, yes.
And what preposition should we use after pop? Can you pop?
To the screen.
Pop up the screen. Pop up the screen.
And
Pop
run.
up the screen.
I think behind.
Behind will be
Just
more
to
appropriate.
be invisible, yes? Okay.
Yes.
Good. The next is for Priyesh.
Ma'am, I was mute. Actually, I was trying to speak. Ma'am, question number 1, we can also write can stand up against the screen and undress.
Stand up against the screen. against the screen and address for me.
Behind the screen.
It depends,
Stand up
yes, you're
behind
right.
the screen.
Yes.
It depends on the situation, so where the people are, so it's also possible. Thank you. Yes, Priyesh, what do you think of the second sentence?
I need to examine your lower back. So if you can tilt, you can tilt yourself.
Twin turn.
Yeah, or,
Turn
you
is the better.
If you can.
If you can turn.
Imagine that the patient is lying on the couch and you say you want to examine his back, lower back, and so
Turn.
Can you
Turn.
please
Turn. Ask him to turn.
Please
turn?
turn.
If you could turn, if you could please turn.
Okay. Well, and the next one is for Ujjwal.
Yes, ma'am. Just cough for me, and again, that's fine.
Great. And then number 4 is for Sayunika.
I would like dash. Do you need any help getting up? I would like you to stand up.
Yes, I would like you to stand up. Okay, unfortunately, we have about 2 minutes left. That is why let's go to the next slide and have a look what was originally initially said by the doctors. So we were right about the previous end. So now I would like you to speak about the